Hi everyone, welcome back. It's been a little over a month since we talked to Albert Marinez, Chief Analytics Officer at Intermountain Healthcare, about how our healthcare system is doing and the impact that COVID is having on us. So today we're going to discuss how we're doing and what the future potentially holds. Albert, thank you so much for joining us again. We really appreciate it.
It's great to be here, Amanda.
It's nice to see you in person again as well.
You too.
A lot has happened since the last time we met too. We've been in this yellow health status and businesses have been opening up and we've had a lot of holidays between now and a month ago. How are things going at Intermountain?
A lot has changed in the last month. We've definitely seen an uptick in COVID cases, but we've also seen an increase in non-COVID cases as a lot of the services for those patients were postponed early on leading into the pandemic. And so far we've been able to balance the demand, transferring our patients in different parts of the Salt Lake Valley hospitals and making sure that they're getting the care they need. But we're getting awfully close to having to activate some of our surge plans as some of those cases continue going up. We've also seen an increase in our COVID-19 testing sites, and we want to make sure that we are able to increase additional capacity so we can reduce the wait time. I think what you'll find is that we are acutely aware of the importance that we have in our community and making sure that our community stay healthy and safe, and we're doing everything we can to do that.
So like you said, we've seen a really big increase in COVID cases over the last month. Can you share how much that's actually impacting our hospitals as well?
Yeah, for sure. Well, and I've shared some of these charts before, but I want to give you a sense of where we're at again. If you take a look at this first curve here, this is basically what our experience curve has looked like. And this tracks all the way from the beginning of our first patient and goes all the way to our current time period right now. And if you go on to look at what the early phase of this pandemic looked like, we classify this as early unmitigated growth. And what we see is a steep increase in our cases. And this is before we had any of the precautions that, of course, we've seen that make a difference now. Early on, what we begin to see is that impact of changes in the community starts to translate into hospitalizations about 10 days after the change. And that's what these color bands show. So I'm just going to walk you through how things have unfolded over time. When you go on to the recommended closures, this was the first step that we had in Utah, and it was to recommend the closure of non-essential businesses. And you can see how that started translated into hospitalizations. We still saw growth, but the rate started to decrease a bit. And as we moved on into the stay home and stay safe order, you can see how that made a huge difference. In fact, what we saw was our transmission rate went from a pretty high level to actually being below 1. And that really made a difference in the growth of our cases and allowed us to be able to move forward and open safely. As we continued moving on into the orange status, we can see that there was a gradual increase during that orange phase, but we don't see too many steep spikes during that period of time. The real climb in cases came next as we went into the low status or that yellow status period. This started in early June, and we started seeing this climb in cases that have continued into early July. Now, in fact, the census of our COVID patients have actually doubled in our hospitals during the month of June, which is pretty dramatic as we're moving forward. Now, the next little bit shows how our case scenarios may look like. And what we're looking at here is currently we're tracking at that yellow line, which is that low social distancing line. Now, if we continue down that path, we are going to have to activate some of our surge plans. What we'd like to do is be able to follow closer to that moderate social distancing line, which is in orange there. And we know that it's possible as we've seen it before, but we obviously need the help of our communities to continue moving forward in that way.
So if we continue in this trend that's kind of peaking up, or even the moderate trend of not necessarily wearing a mask or physically distancing around people, is there an opportunity or a chance that we could reach complete capacity at the hospitals as well?
Yeah, there is. Now, we continue to watch the numbers every day here in Utah, and we're prepared to activate those surge plans if we need to. At this point, Amanda, it is looking like we're getting really close to that threshold where we're going to have to activate our first step in the surge plans. Now, the good news is that we're prepared. We're prepared to support our community, and we're also prepared to take care of COVID as well as our non-COVID patients, which I think is really important.
Yeah, you mentioned the non-COVID patients. I think that's very important to note that if you need any sort of care, regardless of what you're going in for, that just because you hear about this capacity issues doesn't mean you shouldn't go into the hospital. We're still able to care for you. And I do know that there's different levels of care with COVID patients. They're typically in the ICU if they reach that level of hospitalization. So there are specific doctors and nurses with those skill sets. Whereas if you're coming in for something else, you're probably not going to be working with those doctors. So for the community, I think it's important to note that if you need help or you have an accident or something happens, to please go to the hospitals to make sure you get that care.
Yeah, Amanda, it's so important for people to know that. We're prepared to care both for our COVID-19 patients and our non-COVID-19 patients. And we've heard some heartbreaking stories of patients who've unfortunately waited a little bit too long to receive the care that they need. And so we want to emphasize that we're prepared to care for our community for both COVID-19 and those non-COVID-19 patients as well.
So what do we think that the future holds for Utah? I know July 4th was just this past weekend, which worried people about a potential spike. But what do you think the future holds here?
Yeah, well, we're going to continue watching those numbers really closely. And although it seems like we're going to have to activate that first step in our surge plan, we feel really confident that with the community impact of making sure people are wearing masks when they're in public, washing their hands on a regular basis, and practicing social distancing, that we'll be able to get through this quite all right. Now, we're going to continue as a health system to work really closely with government officials, with our health partners, and with local communities that we serve to make sure that we are in a place to care for our patients, not just now, but over the long term. I think it's important, Amanda, for people to realize that the key to a healthy economic recovery are healthy communities. And we're really at the forefront of helping support that. And we encourage all those in our communities to partner with us as we're moving forward.
That's a really good point, too, about the economy keeping open. In order to have a healthy economy, like you said, we had to have healthy workers. So I think it's really important to, if you live in a place that mandated masks, make sure you're actually wearing them when you go out in public. And even if it wasn't mandated in your county, think about where you're going. Are you interacting with people? Do you live with high-risk people? I think the most important thing we can do right now is to wear a mask and to physically distance. Albert, any last words on our surge planning or any messages you have for our community?
Now, Amanda, just what you said before really resonates with me. I think for all of us, we've said it many times before, but it's so true. It's truer today than it's ever been. We are all in this together. And regardless of what is mandated or not, it's really important for us to practice those key principles that we talked about to make a big difference in where we're going as we're moving forward. I still continue to be really optimistic of what the future holds for Utah and certainly for Intermountain Healthcare. And I'm certain that we will get through this and we'll be stronger on the other side.
Well, Albert, thank you again for joining us, and I'm sure we'll talk to you again in the future about what's going on. And if you guys have any questions about COVID-19 or would like to speak to someone to get screened and tested, you can still call our COVID-19 hotline at 844-442-5224. We also have our emotional health relief hotline still available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Like Albert said, when you're going to get tested, there could be a potential wait, so please be patient with us when you're there. We want to make sure our community is safe and that everyone gets the care that they need. Thanks, everyone. We'll talk to you next time.